All right, and we're back with another episode of Black Life Amplified. It's the virtual town hall series with the African American Leadership Forum. My name is Brittany L. Wright with Insight News, and I will be your host for today's show. Before we get started, I want to give a couple very special thanks first to our sponsors who make this town hall possible. So, the African American Leadership Forum, Children's Minnesota, the Minneapolis Foundation, North Point Health and Wellness. And then I also want to give a very special thank you to our partners, the organizations that come together to produce this town hall and make everything happen behind the scenes. Those organizations include North Point Health and Wellness, Children's Minnesota, Insight News, Gray Matter, the Minnesota Spokesman Recorder, Minnesota Community Care, and then today's conversation in particular is also brought to you in part by BEEN, the Employee Resource Group. So today's conversation is a little bit unique. We're going to be ending early, so to speak. We're going to spend the first 30 minutes talking about COVID-19 and Black life, as we always do. But then we're going to switch over to a new platform, over to WebEx, and we want to invite you all as our audience to do the same. We're having a part two of this conversation that's focused on Black men in white coats, and we'll talk more about that in just a little bit. But first, I want to remind you, if you didn't get a chance to watch last week's conversation on Black Life Amplified, we talked about leadership by any means necessary, what that means in practice, and also the conference that the African American Leadership Forum is hosting. The first day of the conference is tomorrow evening to be exact, and tickets still are on sale at AALFTC.org. So make sure you go to the ALF website to purchase tickets, check out the lineup, and really find out what it means to be a part of leading by any means necessary. Now, as I mentioned, today's town hall is focused on COVID-19 and Black life by any means necessary, particularly focusing on Black men in white coats. The documentary focused on the concerns of the lack of Black men enrolled in medical school and that are actively working in the medical industry. So we're going to talk about the ins and outs of that just a little bit, and then we're going to have a much deeper conversation again on WebEx. And so we invite you to click the link in the comments so that you can find out more about what it means to increase the number of Black physicians that we have and make sure that we're doing our part to have representation in the public health sector. So joining me today to talk about all of that, two guests who are not strangers to Black Life Amplified by any means. Up first, James Burrows, who is the Vice President and Chief Equity and Inclusion Officer. I hope I'm saying that right. If not, he's going to correct me, of Children's Minnesota. Thank you and welcome again, James Burrows. And then, of course, we have Ms. Adrienne Thornton, who is a nurse and infection preventionist at Children's Minnesota. So welcome back, family, to Black Life Amplified.
Thank you for having us again.
Thank you for having us, Brittany. Glad to be here.
Glad to have you guys. So I know we don't have a lot of time because we're going to be hopping over to do the part two of our conversation on WebEx, but I did want to talk to you guys about COVID-19 and how you all have been personally impacted by it. Of course, Black Life Amplified, we have to talk about COVID-19 before we talk about other things. So Adrienne, I want to start with you. And first of all, say welcome back. For last week's episode, we pre-recorded our conversation so that you could travel. So you're back now. Tell us about your experience and just what you've learned as it relates to COVID-19 and how it personally impacts families, even yours.
You know, my trip last week was very sad, and it is just another reminder that health disparities exist. The gap between treatment for white and non-white people exist, and it is not improving. My adopted mommy, who happened to be Latino, died of COVID-19. She had a history of chronic asthma, and she had gone to her physician no less than 3 times to say, hey, I really don't feel well. You know, my asthma is really bad. My bones are hurting. Do I need a COVID test? And 3 times her physician told her, no, it's just your asthma. You do not need a COVID test. Had she gotten that COVID test earlier, perhaps the first time she requested it, there is a chance that she would still be living today. But because they waited so long to treat her COVID-19, she literally deteriorated quite quickly once she was in the hospital. And so it's very sad, it's very disappointing. And, I am in infection prevention. My godson, who is her grandson, is an epidemiologist in Colorado. And we were both fighting to get her tested sooner, and we were unsuccessful. So it has really hit close to home for me. And all I can do is tell people that you have to continue to, one, do the right thing. We're not sure how she got COVID, but she rarely leaves the house. And so someone close to her was not wearing a mask, was not social distancing, and was not doing hand hygiene. And so they brought it to her home, which is very disappointing because it's totally preventable. And so it's just a reminder that we have to continue to be steadfast in our practice and make sure we're doing the right thing for our friends and family, because everyone's immune system is not going to be strong enough for them to get COVID, fight through it, and survive. Some people are going to die, and we continue, even though the numbers are going down in terms of the numbers of deaths we're seeing and the number of COVID cases and the numbers of hospitalizations. The people that are still getting it in high numbers, who are still hospitalized in high numbers, and who are still dying in high numbers, continue to be Black and brown people. So we have to do our part to prevent that from continuing to occur in our communities.
Absolutely. And again, we send our deepest condolences to you and the rest of your family. These type of things are preventable, and they absolutely shouldn't happen. Your family shouldn't be experiencing this. And I hope that people continue to really take heed to the warnings that you especially provide every single episode, letting us know what's happening with the pandemic, reminding us that hand hygiene and mask wearing works, it's efficient, social distancing works, it's efficient. If we all do our part to collectively come together and make sure that we're protecting ourselves, we can really beat this thing, and we don't have to say goodbye to our loved ones prematurely. So the reality is that there have been, I believe, over 250,000 lives lost since the pandemic started relatively around a year ago now. And the numbers are declining in terms of the rates of transmission, but the death toll does continue to rise. And the number of infected people also is a very real thing. Those who don't lose their lives still deal with very serious health complications, and not just for the 14-day period while they're contagious and in quarantine, but long after. I have family members who contracted COVID, and for months continued to have a cough or feel very fatigued, or, didn't fully regain their sense of smell or taste, or, have had other complications as a result of COVID. And we just want people to know that it is very real. I want to ask you, James, you actually had COVID not that long ago. Tell us about your experience and what you've really learned from now beating it.
Sure. Thank you, Brittany. And before I do that, I want to say my prayers are with you, Adrian, and your family. And thanks for your vulnerability and sharing your story as well about your mommy. I did have it. I believe I contracted COVID-19 between the 7th and 9th of January. And the thing about it is I want people to realize that it's real. It's something that a lot of times in the Black community, we don't take as seriously. And I was doing hand hygiene. I was masking up. I was doing social distancing. The only place I think I could have caught it is touching something or being something at a park where I was actually masked up, going around the park, just walking around the lake for some exercise. But the reality is, after catching it, it hit home to me in a couple of ways. One is I found out about having it from Children's Hospital staff who tested me the day that we were doing a vaccine hesitancy show, a panel for many people at Children's Hospital. We were doing it with our ERGs. And in the middle of the show, they sent me a call and said, hey, you have COVID. So I was like, wow. And I kept going with the show. And I was like, man, okay, I have COVID now. And then the reality set in that I needed to isolate for 14 days. And I have a daughter, a beautiful daughter named Teresa Ann Burrows. And Teresa wouldn't be able to see daddy during that 14 days. So she has sickle cell disease and has a immune system that I don't want to compromise with COVID or anything else. We wanted to make sure that she was safe. So I couldn't see her for about 14 days. I had to isolate in my home for 14 days. I had to think about and look at the number of deaths, which I think is about over 500K now of deaths in this country, based upon COVID-19. And to think about it, that's more deaths than we've had in some of the world wars we participated in over the years. So that settled into me, and I didn't get nervous or scared, but I realized I needed to tell my story. So as I was sitting there, I put on social media, I told friends, because a lot of times if we don't tell that we have contracted this disease, that it is real, that you can still get it, even if you're practicing the things you should practice, our community will be more alert to and make sure that we're thinking about, how we need to get out of this by doing those things. Since contracting it, obviously, I recovered well. I didn't have a lot of harsh symptoms. I had loss of taste, loss of smell. I had the chills, but no severe cough, no need for a ventilator. I realized I had it when I went to the gym and I couldn't breathe, and I hadn't been working out that long. So I realized that, okay, something may be wrong as well. But coming out of it, I was great. A lot of people sent me lots of love. They sent lots of elderberry, lots of zinc, lots of vitamin C, lots of vitamin D, lots of juice, lots of tea. And it all worked well in getting me to recovery. So I still have every now and again like a scratchy throat or some challenges breathing not as much, but I think that I'm fully recovered. And by Adrienne being my friend, an infectious prevention nurse friend, she keeps me honest about going forward. The last thing I'll say is this: I want to thank Adrienne and also one of our other special guests we've had on the show many times, Dr. Zeke. I had a family video virtual meeting where we talked about the COVID vaccine recently, and we talked about the importance of taking it. They were amazing on that call, talking about some of the misconceptions, the misinformation, and also some of the legitimate questions that my family members wanted to have asked. So I love the fact that people are considering the vaccine, and you should take it. I had my first dose already, but I want to make sure they get those questions answered. So I want to thank Adrienne and Dr. Zeke for doing that as well. But I'm doing good. Hopefully home free and no more COVID in this household.
Yes, no more COVID in anyone's household. We should be claiming that, and we should be doing the work to make sure that that's an actual reality. And it's something that's within our reach. The both of you actually recently were vaccinated. So one, I want to thank you again for sharing your personal stories on what it was like and when COVID hit so close to home. But I want to also invite you to share your personal experiences in becoming vaccinated. Which vaccines did you receive? Did you experience any side effects? And what can you tell our audience to help kind of take away some of the stigma and fear that I feel like is still out there as it relates to the COVID-19 vaccine?
Yeah, so Brittany, just as a reminder to the audience, I actually was a part of a vaccine trial prior to getting vaccinated. And I really wanted to get vaccinated, so I had the investigators to unblind the study because we weren't sure if I had received the placebo or if I had received vaccine when I got my injections during the vaccine trial. And so once I found out I got the placebo, I proceeded to get vaccinated at work, and I actually co-managed the vaccine clinics at Children's. So I'm there all the time anyway, so it just made sense. And I got the vaccine. The only side effect I had was I had some soreness at the site of the injection for about a day or so. And I made the mistake of actually sleeping on that arm the night that I got the injection. So that didn't help. But other than that, I had no other side effects. I felt fine, and the soreness went away on its own. And I was able to go on with my life. And I'm excited to get my second injection in the next few weeks.
Okay, so note to self, once you get the vaccine, don't sleep on that arm, otherwise you will experience some severe soreness. But other than that, it sounds like you're doing very well. James, what was your vaccine experience like?
Similar to Adrienne, I got it last Saturday, matter of fact, and the only after effects I had was the next day. I had some soreness in the arm. And Brittany, I have some bad news for you. I didn't sleep on that arm that night, but it still was in pain the next day. And it was like a muscle soreness, like you've been working out. I had worked out the day before and done some arm exercises, and it hurt even worse because of that. So probably don't work out right before you take the vaccine. I've had no complications. I'm glad that I took it. I took it here at Children's Hospital because I am a healthcare worker, was able to take it. I want to say this too, as far as the vaccines and employees getting it, we have to encourage our employees of color who may not have enough information about the vaccine or may have some fears or some trepidation about it, to encourage them to get it as well. Adrian and I are leading a cohort work group around that to encourage more of our employees of color to get the vaccine as well. But it's been great. I highly recommend that if you make an informed choice about the vaccine, that's your choice, but make sure you're getting the right information and make sure that it's a choice that you want to make. I highly recommend everybody get the vaccine so we can kind of curb the impact of COVID-19.
Very well said. And speaking of Black employees who work in the medical field, I want to pivot to our conversation now about Black men in white coats. So if you're just joining us, our conversation is going to end a little bit early today so that we can jump on WebEx and continue a conversation with a team of medical professionals. James, Adrian, and myself will be facilitating a conversation about the documentary Black Men in White Coats. But I want to ask you, Adrian, we already know that COVID-19 disproportionately impacts African Americans. Do you think that this would be the case if there were more Black doctors and nurses?
No, we would definitely see better outcomes if we had more Black nurses and more Black doctors. There was a study done in Oakland back in 2018 with two physicians and a researcher, and they did an experiment where they set up a clinic. They had about 14 doctors, maybe 8 were non-Black and the others were Black. And they recruited Black men from barbershops and from the flea market in Oakland and offered them, free medical care if they go to this clinic. And then they randomly sent them to the different doctors. And the outcomes of that study was that about 56% of the Black men were more likely to agree to more preventative care measures, more invasive procedures like getting their finger pricked to check for diabetes or getting blood drawn to check their cholesterol when they were seen by Black doctors. When they were seen by the white doctors, even though those doctors were nice and friendly, the trust wasn't there. The communication was different. And so we have, several studies that we can refer to that show that when you have physicians and medical professionals that look like us, the care is better. We do more care for ourselves, and we have a more trusting relationship with those professionals. And so if we can get more Black doctors and nurses to participate in the vaccine clinics, I've heard people say, well, I didn't want to get the vaccine, but when I went to the clinic and I saw the vaccinator look like me, it just made me feel better, and I trusted them. And so having that person vaccinate me made me feel better. And so we do need to have more people that look like us at these clinics and doing education and informing the community so that we can get the needle pushed on the disparities that exist with COVID-19 between Black and brown communities and others.
Well, I have to say the work that you, James, Dr. Zeke, and so many others are doing definitely is working. You all know that I was not about the COVID-19 vaccine. You all were like, yes, we really have to inform and empower our viewing audience. And I was like, no. We could provide the information, but I'm still on the fence about it. And after having many conversations and you all connecting me with some of the most qualified physicians in the state who happen to look like you and I, it really changed my perspective of the vaccine, about the way in which we should go about navigating this pandemic, about how I can protect myself and protect my loved ones. So I'm not even on a waiting list yet, but I will say that you all have made me more open to the vaccine process as a result of the work that you're doing. So I want to say kudos to you and keep it up. And the work is definitely working. In just a little bit, we're going to watch the trailer for the documentary Black Men in White Coats, talking about the importance of encouraging young Black boys and young Black men to enter into the medical field. James, why was this an important conversation for us to have, especially right now?
It was a much needed and necessary conversation. There are less Black men enrolled in medical school than there were in 1978. So there are less Black male doctors than there ever been. In addition to what Adrian said, when you hear somebody or see somebody who looks like you, who's a nurse, who's a doctor, you build that trust in a system that has let you down over the years. The foundation of healthcare and the foundation of this country in particular is built on systemic racism. So if you have a foundation in the hospital healthcare system built on racism, you're not going to trust even the nicest white doctor, even the nicest front desk staff, until you see somebody who looks like you, have your experiences, can talk to you about some of the biases and racism you may have experienced, and give you the best care and quality care. The other piece of that is the more Black doctors we have, especially Black men, they're in a system now that will help some of the other doctors, nurses, and professional staff to understand the clientele that they're serving. Because if you don't know any Black people, haven't seen any Black people, don't work with any Black people, and then you try to serve them, a lot of that learning curve, that learning gap is going to help you, not help you give the best care. So having that diverse workforce is important. And the last thing is too, I mean, it's important that I want to give a shout out to, and I will when we go over to WebEx, the Black fraternities as part of the Divine Nine, the men of Iota, men of Alpha, men of Kappa, men of Phi Beta Sigma, and the men of Omega Psi Phi stepped up tremendously and said, we want to help sponsor this event. Two of the doctors we have on there, one's a Sigma, one's an Omega, and said they want to make sure that we increase the knowledge about Black men doing well in lots of professions, but also too that we have an urgency around getting more Black doctors. The last piece is, you'll meet him when we switch over, Dr. Calvin Mackey, who's a Morehouse classmate of mine. He said, James, I've been running this STEM program for third graders, fourth graders for many years. That's the pipeline we can create, get more Black doctors. So it's about hiring now, but it's also too creating that pipeline. So I'm so excited to be a part of this work and making sure we have a panel discussion around it.
Yeah, and speaking of the panel discussion, do you want to just give quickly the names and background of who we're getting ready to hear from in part 2 of our conversation?
Sure, I'll do it real quick. Dr. Dave Hamler is a medical doctor and also a dentist. He was trained in both. He does specialty medical surgery, ENT work here at Children's and also University of Minnesota. He is a man of Omega Psi Phi and a great individual. The other is Dr. Simon Ndeli. He's a man of Phi Beta Sigma fraternity. He's in his residency at Children's Hospital in Cincinnati. And I told him once he gets trained up there, come on back because we need you at Children's here in Minnesota. And then the last is Dr. Calvin Mackey, who's a PhD, and he's a classmate of mine at Morehouse College. He is going to be talking to us about his STEM program called NOLA STEM, based in New Orleans, but they also have a satellite program here, partnered with Lewis King and Summit Academy here in Minnesota to get young people engaged in STEM. We have 2 wonderful interviewers or who are running the panel. I think their names are Brittany and Adrian. You know them already, so I won't introduce them, but I'm excited about all the opportunity we have in the next hour.
Yes, it's going to be an amazing conversation, and thank you, James, for the opportunity again. So as I've mentioned, or if you're just joining us, we are going to be wrapping up our conversation live here on Facebook so that we can join on WebEx. Now, if you've been paying attention, our wonderful producers have been making sure that you have all of the information so that if you want to be a part of the conversation, if you want to view the conversation, or even phone in and just listen to the conversation, that you can do so. That information will also be in the chat, so make sure that you check that out. Now, this still is Black Life Amplified, but we're going to go ahead and wrap up. So before we get on out of here, I want to give a very special thanks to the African American Leadership Forum and say go and check out their website, aalftc.org. The virtual conference by Leadership by Any Means Necessary starts tomorrow evening and tickets are still on sale. E.T. the Hip Hop Preacher, Georgia Fort, Justin Terrell, Eli Darris, so many amazing speakers are going to be speaking. We've got DJ Diggy performing, MPLS, Ujamaa Music Group, and so many more. You don't want to miss it. It starts tomorrow evening and tickets are still on sale. Very special thank you to Black Life Amplified's partner organizations, North Point Health and Wellness, Insight News, Gray Matter, the Minnesota Spokesman Recorder, Minnesota Community Care, Children's Minnesota, and BEEN Employee Resource Group, who's getting ready to sponsor the second part of our conversation. Right before we get out of here, I want to remind you that the rates of COVID-19, heart disease, infant and maternal mortality and morbidity, and other disproportionate conditions within the Black community demonstrate just how important it is to have diversity within the public health sector. So then what happens if those administering care, those influence public policy, especially as it relates to public health policy, and those who are training and working as practitioners? What happens when they don't look like you or the people in your family? Well, the answer to that question and why we're getting ready to move to this special platform for part 2 of this conversation can be found in the clip that we're getting ready to play. Thank you, James, and thank you, Adrian. I will see you on the next platform. And coming up right now, you're getting ready to view a special trailer for the documentary Black Men in White Coats. My name is Brittany L. Wright with Insight News. Thank you for joining us. I hope to see you next week as we have a special town hall all focused on public safety as it relates to the George Floyd trial that's coming up here in the city of Minneapolis. And until then, here's Black Men in White Coats. See you soon.
We need more Black men in white coats because we need to save the lives of more Black men. Period.
There were fewer Black men applying to medical school in 2014 than in 1978.
There are several medical schools that do not have any Black men in their classrooms. When that is the case, and we're in a learning environment, there's going to be different conclusions made about how to care for people if there are not diverse people around the table.
You need to care about your fellow man and woman, otherwise we all suffer. So the reason why white people, white women should care about diversifying physician workforce, which includes Black men, is because it makes it better for all of us.
Historically, the system wasn't designed for Black men to succeed.
My mom, on and off drugs, in and out of jail my whole life, and becoming an orthopedic spine surgeon, if I can do it and come from that environment and everything that I went through, I think you can also.
There are little Black boys out there who see me on TV, who see me in this role, and who may not have ever thought that they could be a doctor, much less Surgeon General, who when they see that, all of a sudden think, I can do that too.
We're approaching this as though it's a problem versus realizing that we have a crisis on our hands.
What's the impact if this problem doesn't change?
Black people are gonna continue dying.
Yeah, ain't no time for stressing, I've been really stepping. Ooh. Yeah, if you wanna go get it, stop playing around. Really got on Rex, ain't playing around. Wanna go get it, stop playing around. Really got on Rex, ain't playing around. Black men, white coats, yeah, we up right now, yeah. You gotta set you a goal, you gotta accomplish your goal.
We need more Black men in white coats because we need to save the lives of more Black men. Period.
There were fewer Black men applying to medical school in 2014 than in 1978.
There are several medical schools that do not have any black men in their classrooms. When that is the case, and we're in a learning environment, there's going to be different conclusions made about how to care for people if there are not diverse people around the table.
You need to care about your fellow man and woman, otherwise we all suffer. So the reason why white people, white women should care about diversifying physician workforce, which includes black men, is because it makes it better for all of us.
Historically, the system wasn't designed for black men to succeed.
My mom, on and off drugs, in and out of jail my whole life, and becoming an orthopedic spine surgeon, if I can do it and come from that environment and everything that I went through, I think you can also.
There are little black boys out there who see me on TV, who see me in this role, and who may not have ever thought that they could be a doctor, much less Surgeon General, who when they see that, all of a sudden think, I can do that too.
We're approaching this as though it's a problem versus realizing that we have a crisis on our hands.
What's the impact if this problem doesn't change?
Black people are gonna continue dying.
Yeah, ain't no time for stressing, I've been really stepping. Ooh, ooh. Yeah, if you wanna go get it, stop playing around. Really got on Rex, ain't playing around. Wanna go get it, stop playing around. Really got on Rex, ain't playing around. Black men, white coats, here we up right now, yeah. You gotta set you a goal, you gotta accomplish your goal.